I'm Melinda Dial, and I'm here to discuss a case study patient I saw at the office. It's week 3 video. I'm doing this PowerPoint. I will not by any means be reading directly off of it, but it's here for visual purposes. And there are some statistics I cannot keep locked in this brain, so I may have to turn around and check every once in a while. My patient is a 36-year-old female. Presents to the office today for complaints of just her annual routine healthcare checkup. Her history of present illness: she has HPV, which she was diagnosed with at 24. Since that time, she's had 2 positive tests. She has had 2 leaf cone procedures to remove the cell tissue for testing. Last 2 years have been negative. Other health history on her: she's got asthma, which she takes Asthmanex ProAir, and then birth control. She has Nexplanon in her arm. This patient has no known drug allergies. And just the review systems is just talking with the patient, just asking them any fevers, chills, nausea, vomiting, diarrhea, any palpitations, any concerns today. At this time in the interview, with the patient, I like to kind of just get a feel. Okay, they're oriented, cooperative, their affect is normal. This patient denied any problems. She does her breast exam every month, denies any pain, discharge, or masses in the breast. So physical health exam on some of these we already went over. She's alert and oriented to place. She's answering appropriately, to the questions asked. We look at, the head, the throat, the ears, check out any lymph node involvement, the swelling, cardiac. She had a normal rate, regular rhythm, which is a normal rate. No murmurs noted. S1, S2 is heard. Respiratory, I focus in on more so than some of the others because she does have the diagnosis of asthma. Chest was symmetrical. No effort breathing, no wheezing noted in all lobes. Clear in all lung sounds. Abdomen is soft, non-tender. Bowel sounds are active in all 4 quadrants. This part I usually will turn around and kind of tap on their kidney area just to make sure there's no tenderness noted there. Skin is pink, warm, dry, intact. No cuts, open wounds, anything like that. We already noted earlier she had a normal effect, and then the breasts were small size. Thickening was noted, which in most young people, almost all of them are thickening noted. You'll feel some. No palpable nausea, tenderness noted. I checked axillary region as well for lymph nodes, swelling. And then you look at the outer that outer, the labia majora and minora. Make sure there's no lesions there. There wasn't. At my office, we use the metal speculums. The metal speculums inserted, open, cervix is visualized. I don't see any areas that would make me question any problems. The vagina was mobile. No discharge. Somebody will usually see slight discharge in everyone. So when I say no discharge noted, there's no foul smell, no yellow, lots of white seen. And then on bimanual, you check for cervical motion tenderness. This patient had none. No adnexal messes were palpated at that time, so no concerns. So our diagnosis for this patient: Z11.51, an encounter for screening for the human papillomavirus, and then your annual women's health exam, Z01.419. So most of us have heard HPV is readily marketed now with the new Gardasil, which is great. But a lot of people don't know the ins and outs of the HPV. It's a virus that produces epithelial tumors on the skin and mucous membranes. It is a sexually transmitted virus. This part, I will tell you, the literature states differently, but it's always more than 100 when you read how many different types of the HPV viruses. One read said more than 150. And some say up to 11 to 12 can cause the cervical cancers. Some of the viruses have no symptoms or negative outcomes. The most common form that we see are the 16 and 18 of the HPV. So like we talked about Gardasil, you know, all of my kids, well, my 2 older kids have both been vaccinated for the HPV vaccine. They've had the HPV vaccine. But before the HPV vaccine, it was just readily being spread through people, through intercourse of whichever means. And these reports you'll see here are talking specifically about the genital herpes, or the genital HPV. Some are, like when you look at anal, some are oral, but this one for this patient is just the genital. So for prevalence and statistical reporting for that, the CDC, which is such a high number to me, reports the prevalence of HPV during 2013 and 2014, because that's the newest statistics that they do have. The prevalence between people with the age of 18 to 59 was 42.5 in the total population, so that's almost 15%. 45% roughly of these were men, 39% roughly were women. And the total population, men are higher than women is what that's saying. And so this is just a graphic chart that I pulled from the CDC to show you. This is the, again, total of the genital HPV. And you're looking at the 42 percentile. The blue is all population. The light blue is men and the green is women. This is total population. Then it takes you over to a breakdown of specifics. This is the non-Hispanic Asian. This is the non-Hispanic white. This is the non-Hispanic black, and then this is all Hispanic. So it just kind of gives you a layout of ethnicity and where the diseases are greatest at. So obviously HPV, your biggest risk factor is going to be cervical cancer. That's why we do the screening, and that's why there's such a push on the Gardasil now. There are other risk factors I found. Persistent HPV infection, which is something that's more than 24 months that you're dealing with. Obviously HIV is another thing that's, your immune system can be lowered, so it gives greater room for the virus to spread and fight. Other STDs, oral contraceptives, smoking is like a precursor of anything, so smoking is also one. Having more than 3 full-term pregnancies, which I found to be weird, puts you at a risk for cervical cancer. And anal fistula is the other one. So symptoms with these patients, I've known enough people even, you know, you don't have, when they're younger, you don't have regular gyne checks, you just don't think about it. Some of them become pregnant and then they go to the gyne for the first time, your OB, and they test for all that. So then not only are they pregnant, but they just found out they have HPV. So a lot of times no symptoms are there unless you are one of those people that break out in the genital warts, which this patient did not and has not ever had. So they had no symptoms, they didn't know. So for her, no labs needed. She's asymptomatic. Diagnostic testing we did was we took the cervical specimen and we're going to send that off for pathology report. And then for screenings for any person with the HPV, you know, in regard to it, looking at it, they want everyone from 21 to 29 every 3 years with cytology pap testing, regardless of age of onset of sexual activity. For people 30 to 65 years, every 5 years with HPV co-test and pap, or every 3 years with cytology. So she's exempt from this, and there are other people that are exempt because she had 2 leaps with precancerous specimens noted. They test her every year, and if you get a positive, it's every 6 months you have to be tested for so many years. So she's to the every year. Last was negative, I think I said that earlier. And then really no referral other than follow up with your primary care for any of your other needs, or follow up with us in a year, unless there's an abnormal pap, which we would contact her. Education for her would be, she just has one partner, so they both have it, so you don't have to, but for someone else you would want to tell them, you know, multiple partners is not a good thing, and if you are, you need to be using protection. This patient would need to return if she had any vaginal discharge or worries about anything else. She doesn't think her birth control is working or her periods are too bad. that's when she would need to come up with us. But otherwise, just follow up in a year unless, like I said, the normal PAP results. And that concludes my case study or case presentation to you about my 36-year-old female. Thank you.